Hello everyone, welcome back to my YouTube channel, Nursing with Beatrice. So today we'll be looking at a very important topic, diabetic ketoacidosis, what we call DKA. So today we'll look at the definition, the pathophysiology of diabetic ketoacidosis, the causes, the signs and symptoms, how to diagnose this condition, nursing management, including medication, and teaching. So please stick around because you will find the video very beneficial. So let's start. So diabetic ketoacidosis is a sudden life-threatening complication of diabetes mellitus, commonly seen in type 1 diabetes. So this is due to lack of insulin. Remember, in type 1 diabetes, there is no insulin to work on the glucose, to take those glucose to the cell. So if you want more knowledge about this, you can watch my video on diabetes mellitus. Insulin is a hormone produced by the endocrine function of the pancreas, by the islet of Langerhans, beta cells of the islet of Langerhans. So what it does is it works on those glucose when you eat, with those glucose that is produced, it works on it, takes it to the cell where the body needs it most. So it's like the major source of energy, the glucose. But insulin needs to carry this glucose to the cell for use. But in a situation where this insulin is lacking, like in type 1 diabetes, and it gets to a point where glucose becomes so high in the blood, it can result to a complication we call diabetic ketoacidosis. So for the pathophysiology of this DKA, I break it down into 5 phases. The first one is lack of insulin. Like I said, no insulin to do the work of converting those glucose. So that will result in hyperglycemia because the glucose will just be many and they will just be flowing in the blood. And when this glucose is just high and flowing in the blood, which is the second phase, the body still needs glucose. They need energy. So they fall back on an alternative source. So they fall back on breakdown of fat, which is what we call lipolysis, which is like the third phase of this whole process. As they begin to break down the fat to release energy, with time, the ketones begin to build up, which is a byproduct of this breakdown of fat or fat metabolism. Now, this ketone, which is now the fourth phase, ketosis, the formation of ketone bodies, is acidic. So it begins to build in the system, It gets to a point where there will be imbalance. So what we call metabolic acidosis. So the acid builds so much in the body, bicarb will decrease. The usual level of bicarb is between 22 to 26, but in this condition, the bicarbonate may get as low as 15. And metabolic acidosis, the acidosis there too, the pH, the usual range is between 7.35 to 7.45, but in DKA, they may experience a pH less than 7.35, so which is acidic. So this is how this condition happens, and then they begin to manifest some signs and symptoms. So first, hyperglycemia is going to be a sign and symptom. The glucose will be very high, above 300 milligrams per deciliter. It will be that high. And as the glucose is high, the kidney that is supposed to filter glucose back to the blood can get overwhelmed. So when it gets overwhelmed, it gets to a stage where the glucose begins to escape through the glomerulus, and then it's escaped to the urine. And glucose it loves water. It pulls water along with it through osmotic diuresis. So as they are urinating, they are pushing out a lot of fluids. In the process too, some electrolyte might go along with it, like sodium, potassium, chloride, and all that. So they begin to experience dehydration because of those too much fluid. They are urinating a lot. Too much fluid, they experience dehydration. Some of the signs of dehydration, you see them, they will be weak, the skin will be dry, and you could see the eyes will be sunken, the lips, the mucous membrane will be dry, they will be very tired, fatigued, and all that. Then another sign and symptom we see is fruity breath. That is from that acetone, from those ketone bodies that have built up in the system. So with time, you perceive that fruity breath, acetone breath. So that's another sign. And then there's what we call Kuzma respiration. So this one is from those metabolic acidosis. Because of those excessive acid in the body tries to compensate. They begin to hyperventilate to blow out those excess CO2, those acids from the body. And so because of that, you see the breathing in Kuzma respiration, it will be deep and rapid breathing. You notice it in patients with DKA. Then they will experience anorexia. There will be no appetite, nausea, vomiting. And when it gets too serious, it can lead to mental status changes where they become very weak. They will almost get into coma. So now, what are the causes? I also group it into three classes. So the first one is either there is decreased or missed insulin. So this one happened basically in patients with type 1 diabetes, like I said. So they depend on insulin for the rest of their life. But a situation whereby they forgot to take their insulin and they've eaten, there's no insulin to do the work. Glucose becomes so high and they could go into this condition. Another one is in illness or an infection. There is stress, and because of that, glucose also will build up in the system, and then it can result to those the condition hyperglycemia, and it can get to DKA. Now, all diagnosed or untreated diabetes. So, if they had this glucose and it's not treated properly, it gets to a point it becomes so high, it can get to a complication of diabetes mellitus where they will develop DKA. So now let's look at how we diagnose diabetic ketoacidosis. So to diagnose it, the first thing when they check the blood, they will be seeing when they do blood glucose test, they will be seeing glucose as high as greater than 300 milligram per deciliter, to be that high. And one unique thing you need to know, especially for your nursing school, for your exam, is the presence of ketones in urine and in blood. So there will be this presence of ketone in their urine, there will be presence of ketone in their blood. Just also there will be this fruity smell that they will feel, that acetone breath. Now, how do we manage diabetic ketoacidosis? So to manage it, based on the signs and symptoms they are presenting, because they are experiencing dehydration, we are going to rehydrate them a lot. We're also going to reduce their blood sugar, because part of the problem is that the glucose is very high, greater than 300 milligrams per deciliter, so we'll be reducing their blood sugar. Remember also, because when those fluids are being pushed out, when they escape through the glomerulus, some electrolytes are also lost, and also the insulin itself that we're going to use to reduce glucose can also affect the electrolyte, especially potassium. It can make potassium to return back to the cell, and that could reduce potassium in the blood, what we call hypokalemia. So the management is going to center around this. The nursing intervention is going to center around this whole process. So for the hydration, we hydrate them based on the prescription by the healthcare provider with normal saline. We give bolus, and then we continue to titrate. So when we give this normal saline, it's an isotonic solution, so it's not going to make the fluid shift from one intracellular to extracellular. No, it will just stay in the blood, because we need it to be in the intravascular space to expand the volume. Because remember, when the patient is dehydrated, the blood volume is also going to be low, because plasma is about 55% of the blood volume. So when they lose fluids and all that, the blood volume decreases. So we need to expand that intravascular space with what? Fluids. So we give fluid, we give normal saline. So, and then, because we are giving fluid, we want to prevent hypoperfusion of major vital organs like the brain, the heart, the kidneys. At times, the prescriber may may put the patient on hypotonic solution, like 0.5% normal saline, so like 0.45 normal saline. So if we are giving this, we have to do it with caution, because if the patient is receiving hypotonic solution, through osmosis, fluid is going to move from the region of lower concentration of solute of glucose to a region of higher concentration. So if the fluid moves and they shift back into the cell, it can get to a stage where the cell begin to swell up, and that could make the fluid to push into the cerebrospinal fluid, mix with the cerebrospinal fluid, and can lead to cerebral edema. So part of our goal is to prevent cerebral edema, because that can lead to increased intracranial pressure. That one's another emergency we don't want to develop from this management of this condition. So we're always monitoring them very well. Then reducing blood glucose, we give insulin. The prescribed insulin, when we give the insulin, at times they may prescribe a bolus of insulin and then the continuous titration of insulin. Make sure most times we use the pump so that we are able to regulate it properly, so that we don't give too much insulin. But one thing I want you to know about this, that while we're giving the insulin, we don't want to drop the glucose too rapid, because if we do that, there's going to be a shift. And when there's a shift, the fluids that will move out, it could get to the brain, to the cerebrospinal fluid, mix with it, and can lead to cerebral edema. So we decrease the glucose gradually. So because of that, when we are giving the insulin, we are monitoring the blood glucose. If we drop below 250 milligram per deciliter, we want to replace. So they can add 5% dextrose. Though it looks funny, like this patient already, part of the problem is because of hyperglycemia. Why are we giving glucose again? Because we don't want that glucose to decrease suddenly, so that fluid will not shift to a point where it gets to the mix with cerebrospinal fluid and the patient is now having cerebral edema and increase intracranial pressure. So because of that, we reduce the glucose gradually with insulin. Then we are going to replace potassium. When you give insulin, it helps to promote the uptake of potassium back into the cell. Remember, the major intracellular element is potassium. So, but when there is a problem like in DKA, potassium may shift out to the extracellular. But we want, with insulin, it can lead to promote the reuptake of potassium back into the cell, meaning the patient may suffer hypokalemia. So we want to replace that potassium. So they may prescribe potassium, which we will titrate through IV route. So you give the potassium, you give it gently also, and you monitor closely. You monitor the patient closely. So like in the summary, we are hydrating the patient with fluids, we are reducing blood sugar, and we are replacing electrolyte, especially potassium. And patient with diabetic ketoacidosis, it is very advisable that you place the patient on a cardiac monitor. You want to watch out, see those changes that are happening, especially because you don't want the potassium to be too low. You don't want any changes that will kind of affect the body. So now the potassium, the normal range is between 3.5 to 5.2. We want to make sure that before we even start giving the insulin, we want to make sure that the potassium is within that normal range, or at least up to 3.3 before we start titrating with insulin. And we monitor to make sure that the potassium is within the normal range while we are giving this. We don't want it to be too high. We don't want it to be too low, right? So, and then patient teachings, very important. So for patients that have had diabetic ketoacidosis, we want to teach them to avoid this. So next time. So we teach them that make sure, even if you are sick, make sure you still take your insulin, make sure you still eat. Do not miss your insulin. And then we tell them to monitor your blood glucose properly, carefully. And if you feel that fruity breath smell, that acetone breath, or you feel some funny, kind of that it's not usual with your body, report to your healthcare provider immediately so that proper action will be taken, so that you won't come down with this condition again. So that wraps up today's topic on diabetic ketoacidosis. If you find this video helpful, please, I want you to like this video. I want you to share this video to others, especially to nursing students, so that they can also benefit from this. And I want you to hit the subscribe button for more videos. If you want a particular topic treated, maybe you're having a challenge with a particular topic in your school and you want me to talk on it, please leave a comment in the comment section. Thanks for watching.